medication.
Medication for chronic kidney disease and any other.
Sorry, what's that?
Oh,
I don't know what's that.
so you want to know more about your disease
Yes.
and more about medication.
Yes.
Okay. And before we go about the medication part, I want to ask some few questions.
Okay.
And I want to know, how do you sleep? Do you sleep well, or how many hours do you sleep a day?
I think I sleep well.
You sleep
Yeah.
in over 6 hours.
Yes.
It's over 6 hours.
Yes.
And do you smoke or drink alcohol?
Actually, I don't smoke.
You don't
But I need to smoke. I need to drink.
You need to drink.
Yeah.
So you drink quite often.
Yeah.
That's because sometimes your medication and alcohol will have drug-drug interactions. So I will make sure that if you have alcohol, and I'll tell you that
I drink sometimes.
sometimes only.
yeah.
Okay, good enough.
At work dinner.
Okay,
or
okay.
Or with my family.
Okay. And do you like to exercise, or you like me, a couch potato?
Well, I have no time for exercise.
You have no time.
I'm
Okay.
too busy.
So you sit when you work.
Yes.
Yes. Okay. And you have dinner with your family, or you have dinner by yourself quite often?
Since I have no time to eat with my family, so
Okay. So what kind of food do you like, or for dinner, or any time else?
mostly I take fast food or
Fast food?
Yeah.
Okay. Do you drink water often, or did your doctor avoid you to limit water intake?
I drink one.
Have you drink water? How about how much a day? 2 or 3 bottles.
Yeah, I think. Yeah.
I think. Okay. Do you have any medical allergy or food allergy, like shrimp or what?
No,
kind?
not at all.
Not at all. Okay. So let's talk about your medicine. Can I see your prescription bag?
Prescription bag.
No, your medicine bag.
Oh, this one?
Okay, let's
Okay.
see. Okay, and let's make sure what you're currently taking. And all these medicines are you taking right now, including prescription drugs or over-the-counter ones. Is this all you're now taking, or this is the new ones?
Yes. This is the recently.
Okay, recently. Okay, and do you eat Chinese medicine or any health supplements?
I don't take
Okay.
Chinese medicine or herbs.
Okay, and do you know how to use them or how to take them the correct way?
I'm not sure if I need to take so many drugs.
You don't know why you have to use so many drugs. Yes. Okay, and I will explain to you later. And later, I want to make sure. Do you eat those medicine on regularly prescribed, or
Yes.
you will sometimes forget them?
I don't like to take so many drugs because I think I'm healthy.
Okay, but
I have no any discomfort, so I'm confused.
okay, it's okay. I will explain to you later. And now I want to tell you if sometimes you forgot to eat your medicine, and you have 2 different doses for you. Some are for one day once, and some are for one day twice. And if there's one day once, the medicine like this kind, you see over here, yes. And this if you miss dose of those medicine, you just quickly eat it when you remember it. And if this is twice a day, and you may take it. If it's too close to the time, you should take the next dose. You should just skip the first dose and take the next dose. Just don't do the 2 doses together, okay? And where do you store your medication at home?
Sorry?
And where do you put them at home? Like near the bathroom something? Or you put it in your bedroom?
I put it in my bedroom.
Oh yes, I just want to let you know that some of them are scared of water, so you have to stay them not in moisture place and not for straight light. Yes, and then I want to talk about some medications, and you have a lot of medications. So I want to first check that if they're. I saw your ID and I go inside to look about your diagnosis, and I saw that you have diabetes, and you have hypertension, and you have you have too much uric acid, so you have blood 4. Yes, is that correct? And you have high lipid.
Yeah.
Yes. So those are the medicine for you to use for those disease, and I will explain that which medicine are for those disease. So let's start with calamate. Calamate is to drop down your blood, the potassium in your blood, and because you have too much potassium in your blood right now, and if you have too much potassium in your blood, it will cause severe diagnosis, like arrhythmia. It's quite dangerous for you. So that this medicine is for you to down the potassium in your body. And how do you take this? And you can see this one in your package, and just rip it off, and the powder inside just pour into a cup and mix it with 30 to 50 ml water and just drink it. And make sure that you have to do it after meal, and don't use it with other drugs. Separate them at least for 3 hours. Yes. Okay? And then I want to talk about your type 2 diabetes, because I see that your HbA1c is 7.3. It's quite higher than 6.5 as normal people. So you have 3 different kinds of medicine, like metformin, 1 for twice a day, and Forxiga, 1 for once a day, and Hoju for injection, and it's before 9. It's just before bed, yes. And all of them is for you to lower your blood sugar. But when you lower your blood sugar, it's because the side effect of those medicines is hyperglycemia. And what is hyperglycemia? It's make you feel shaky or wet or head pain or irregular heart rate that may cause medical questions. And then how do you treat them when you find that you have low blood sugar? Is you have to go test your glucose in your body. So we have glucose meter, and if you find that the number is lower than 70, and you should quickly get some sugar, like candy or something like that. But the lipid decrease, but don't use chocolate because the lipid will decrease your absorb of sugar. Yes, and I want you to know that Forxiga may cause some side effects like urine tract interaction, so you have to drink more water to avoid that. And then for your hypertensinemia, you have Diovan, Dixaban, and Dietrin. You have 3 different kinds of medicine. And I want you to know that it is important to check your blood pressure every day, and at the same time and after rest. And because those medicine may cause dizziness or blurry diffusion, or you have hands and feet cold or nausea, that may cause falling. And falling is very dangerous for you because if you hurt your head or something else, it's quite dangerous. So I want to tell you that you do every action very slowly, and when you wake up or you change any actions like that. And I want to tell you that the Litrin, this medicine is a beta blocker. And if you use beta blocker and the insulin on the top, this both mixed together, the Litrin will hide the low sugar sign of your body, so you may not